Hey guys, Dr. Sarah here from Balance Within Physical Therapy. I wanted to talk today about the importance of deeply releasing C-section scars. So it is very, very common in the traditional therapy world or the medical world to talk about loosening up scar tissue at the surface level or the skin level, which is great and also important. Oftentimes that involves, as things are mostly healed, doing some gentle massages, maybe even some rolling of the tissue, maybe applying some vitamin E or different types of topical things to help that scar not be keloid inflammation or raised or have a large scar. That is great. And there's a lot more to it than that. So when there's a C-section surgery that's done, we're actually cutting through 7 different layers. So if we talk about the skin, the fat tissue, the fascia, the peritoneum, which is a layer of connective tissue, the musculature, the uterus itself, and the the amniotic sac too, there's a lot of layers. Just in the muscles, there's actually 4 layers of abdominal muscles that we're cutting through. And so you can often think of these abdominal scars like a plant with roots. There's the superficial area that we see at the skin, but there's deep roots for the scar tissue that forms as we heal. And it's very common for the scar tissue to tether deeply. I've had women I've worked with abdominal scars and or C-section scars that maybe are having nerve symptoms down their leg or back pain, and they aren't realizing that there's nerves caught up in that scar tissue, or that those roots are kind of tugging even into their back. I've worked with women with constipation problems, and they're not realizing that that scar tissue is even impeding their digestion. And so for all of those reasons, it's important to gently work on the deeper layers too. Another piece that I see that's very important is it's really common for women to have a tough time firing their abdominal muscles after a C-section scar, where they just feel like, I can't even feel those muscles, I can't tighten them properly. And it's like there's a stranglehold on those muscles. And so that's where it's really nice to do a gentle form of myofascial release. That's a specialty at our clinic, where instead of working superficially, we're actually sinking into the scar deeply, hooking those tissues and pulling them and gently waiting for that scar tissue to melt over a few minutes. And it usually takes a couple of sessions, but then after it's released, I hear all the time, oh my gosh, I can feel better into my abdominal area. I can actually contract my abdominal muscles, and I haven't been able to do that for so long. My digestion's better, my back pain's better. It is a game changer. So just wanted to throw that nugget out there. If you're having some funky symptoms and this hasn't been addressed yet, or you just want to prevent problems down the road and get your core functioning and firing like it should, I highly, highly recommend addressing this piece. If you're looking for more great resources on pelvic health and postpartum recovery, we have some great free guides on our website at balancewithinpt.com. And then we do have a limited number of free consultations each month where you can pick our brains, and we are happy to be a resource for you too. So you could always sign up for a discovery consult. Here to help if you have any questions. Otherwise, have a great day and take good care.